Holism, the idea that all life is connected and interdependent, that nothing can be fully understood unless one sees the whole. Using their ears to listen, their eyes to see, their hands to touch. Osteopathic physicians are making a difference. In an age where healthcare is increasingly an impersonal business, there is a career that truly makes a difference: osteopathic medicine. Some physicians typically look at the disease first and the patient second. Osteopathic physicians look at the patient first with an emphasis on treating the whole person. That's the DO difference.
The best part about being an osteopathic physician is being able to look at the person as a whole. You see them not as a disease, but as a person. As a person, how they fit into their family structure, how they fit into their community, and the social aspects about that. Also, how their spirituality plays into that. You know, their emotional and mental health is a huge part of physical health. And being able to create that connection with the patient. And that's what holistic medicine is.
The way I make a difference as an osteopathic physician is being able to take that holistic approach and use that in a family practice. We see whole families in our community, so it becomes a place where people know what kind of services we offer, what kind of treatment they're going to get, and they enjoy coming to our office because they know they're part of our family.
¿Cómo estamos? Okay.
I just love feeling connected with the patients, and they are so appreciative to have someone who has taken the time to learn their language and can communicate at a physician's level as far as knowledge, but bring that to their level in a way that they can understand it, in a language that they can understand. Because it's really rewarding when you finally connect with that patient and you feel like you made a difference. I mean, and that's what it's all about.
Working in concert with today's medical technology, osteopathic doctors use their ears to listen caringly to their patients, their eyes to see each patient as a whole, and their hands to touch, to diagnose and treat injury as well as illness.
The ability to put our hands on a patient and do manipulation is, I mean, it's a great tool to have. And you can, deal with their medical problems, their pain, do some manipulation, and actually see a difference.
I love being an osteopathic physician and knowing that I have another modality that I can use to help treat them. So instead of just throwing pills at them, I give them a handout, I demonstrate the stretches, I'm able to do manipulation and work on their bodies, touching the patient.
In communities throughout Alaska, Idaho, Montana, Washington, and Oregon, the Northwest Osteopathic Medical Foundation promotes healthy outcomes for people by convening medical professionals to solve critical healthcare issues, by promoting the osteopathic profession, and most importantly, by helping to seed the next generation of physicians through the Foundation's scholarship program.
Scholarships play a very important role in being able to get through the gamut of medical school and residency and having the freedom to practice where they would like to instead of feeling strapped and having to stay somewhere because they have so much debt.
Scholarships are important for medical school, particularly in these times. We have increasing tuition costs. We have lower reimbursement, especially in the primary care settings, and anything to reduce that debt before procuring that debt is important.
DOs practice in all medical disciplines, from primary care to surgery. Although they often seek out opportunities to serve in rural and underserved communities, you'll find them in areas that range from major cities to small towns.
In a way, I'm seen as a pillar in the community, not necessarily because I'm important or because I'm famous or anything like that, but I'm a constant. Especially because the work here is seasonal, a lot of things change and a lot of the patients move up and down the West Coast, but they know when they come back, I'm their doctor and I'm gonna be here. And I like to be able to provide that stability for these patients who haven't had the stability. And that helps make you feel vested in your community. And it makes you not want to leave. This is my home.
DOs make a real difference. That's one reason why osteopathic medicine is the fastest growing healthcare profession.
I'm the one who can touch one person's life today that nobody else is going to get that chance to do. And so maximizing that opportunity and taking that extra moment to make it real to them and educate them and tell them I'm looking forward to seeing them again in 4 to 6 weeks. I guess that's what gets me up in the morning is knowing that I'm making a difference and that these patients have nowhere else to go and they depend on me. And I depend on them because they keep me going too.
Now you too can make a difference by contributing to the Northwest Osteopathic Medical Foundation's scholarship program. Give today and be part of a living legacy.